how to prevent falls, breathing techniques, problem solving, decision making, and one of the main tools in the program is action planning. Action planning is similar to goal setting, where the individual participating in the program decide on an action to be taken for each week of the program, and then they report on the action the following week. It's also a form of support. So the program is for 6 weeks, and each week the session can last 2 to 2.5 hours. It's once weekly. The program is at no cost to persons living with chronic condition, their family, or their care provider. So the program is actually open to everyone. We encourage persons living with chronic condition to participate in the program. However, we invite persons who are just concerned or interested in healthy living to participate, because everyone can benefit through this program. So the mode of delivery for this program is that we focus on small group participation, and the program is offered in 2 modes. So you can have a virtual program, an online program, and in the online program, the number of participants are 8 to 12, and that is to encourage participation. And in our face-to-face program, in-person program, we can have 12 to 16 participants. So like I said before, it's a well-studied program. It's a licensed program. So any individual or organization offering the program must do so under a license. So presently, from the inception of Ministry of Health offering the program, we have been operating on the license of the Pan American Health Organization, PAHO. And like I said, for the program, you need 2 trained leaders at each session to offer the program. And also, as part of the program, there is a manual and a book. Each participant of the program encouraged to get the book, and the book is entitled Living a Healthy Life with Chronic Conditions, and each participant should have a book. The book offers more information on all the topics that are discussed during the program. So here you can see a photo of the book, and the book is available online on Amazon. Persons can access the book. So what are the benefits to participating in the program? Persons participating in the program can expect to have improvement in physical activity, exercise, improvement in general health, their communication methods, improve emotions, improve socialization. There is fewer hospitalization, fewer days in hospital, and fewer outpatient visits, which we all our facilities, different level, whether it's the wellness center in primary care or secondary care, the hospitals can benefit from. And many of these results, according to the research, it persists for as long as 3 years. Persons who undergo the program can repeat the program at any time, so it's not a one-time program. I think there was so for in St. Lucia, like I said, we started in 2015 under the Ministry of Health, and one of the master leader trainers has since retired, and up to date we had 112 community workshops, And we trained 112 community leaders to implement the program. So we did work within government organization. We work with NGOs such as the St. Lucia Diabetes and Hypertensive Association. Also, we work with the sickle cell. We had leaders trained from the Sickle Cell Association. We work with faith-based organizations, and our leaders did represent persons from all the districts on island. And prior to COVID, we had already registered 762 persons living with chronic conditions, whether it was their caregivers, family members who had already participated in these workshops up to 2019. We also had very effective testimonials from persons who did participate up to that stage where persons actually quitted smoking. Persons saw remarkable improvement in relationship due to changing communication techniques, and we had lots of testimonials documented prior to COVID. So during the pandemic, actually in 2020, we did have some workshops ongoing that we had to come to an abrupt end because of the physical distancing and so on. And then the developers of the program developed the virtual mode. And we had 2 virtual programs implemented in 2022. Well, sorry, we had 5 virtual programs implemented. And for 2023, we've had 3 programs so far. So some of the challenges that we're experiencing in the implementation of the chronic disease self-management program is that we need to operate away from our clinics. We want to do the implementation within the community setting. And we've had lots of challenges because we noticed that persons do not participate in groups like we used to. Initially, when I started as a community health nurse, we had groups, diabetes and hypertension groups in all the communities. And it is very difficult to get persons to come together and participate in these groups now. We've tried to incorporate the chronic disease program with HATS, which is the module that we're using for the management of hypertension, to offer self-management and support. Most of the leaders were not part of the ministry or government organizations were asking for some form of incentives because persons would have to travel, and sometimes the program was being offered at unsociable hours after working hours, and then as part of Ministry of Health, we were never able to offer that form of incentive. So we've lost a lot of our leaders because they could not maintain the requirement to be licensed to offer the program. So currently I've taken on the post of coordinator since the retired master trainer was the coordinator, but with added responsibility, it's really a challenge in achieving that role, but I do my best so far because I know the importance of the program and the value of the program. Like I mentioned before, the COVID-19 pandemic did cause a stress on us because we had to we had to offer the program virtually, and with our patients and their family members and so on. It's not everybody who is technologically savvy to have maybe a laptop or their mobile phone or even internet access that could have accessed the program virtually. Although we did get support from Pan American Health Organization where they offered us laptops and so on that we could rent to the patient. So we still have that option available for a group who would want to have the program virtually. So with the virtual program, a lot of work was put into it because prior with the face-to-face, we were not allowed to use PowerPoints and so on. But with the COVID pandemic, the developers had no choice but to develop standardized PowerPoints and that the leaders could use. And also they did provide refreshers for the leaders on implementing the program virtually. So we do get a lot of support when it comes to the implementation of the program. So like I said before, majority of the leaders that were trained prior to COVID are no longer certified. However, there is a refresher program that can be offered for persons who are still leaders who are still interested in offering the program. And like I said, also the program is copyright and St. Lucia is operating on the Pan American license for the program. As part of the requirement for licensure is that master trainers must submit annual report to the Self-Management Resource Center. And also the master trainers have to ensure that the leaders who implement the program, they implement the program observing the fidelity to the program, because you will appreciate that since the program is based on research, there must be standardization in offering the program, because if this is not maintained, that means each leader would be offering a different program and the results will not be the same. So with the research that has been done on the program so far is that the program must be implemented in a standardized form to get the results that we expect. And this is very important. So thank you very much. And I am now open to any questions that you may have on the chronic disease self-management program. Hello? Yes, there is a plan to train new persons, and we're working on that plan. One of the weaknesses we had prior is that we were just training persons who express interest, but with continuity in training leaders, we will be developing almost something similar to a memorandum of understanding or conditions to train leaders that persons must implement the program after the training. The training for leaders, it can be done in two ways. We can have face-to-face training for leaders, which is a 5 full-day workshop. And at the end, well, part of the training is that there are 2 teaching practices that the person must successfully complete, each leader must successfully complete and then the leader, after the training, you must implement one community workshop within 12 months of the training. There are persons who were trained and we had great difficulty in getting them to implement one workshop within a year's time. So we want to train persons who are really interested in implementing the program. The other mode of training is that there can be a virtual leaders training, and this virtual training, it's 13 sessions online, and it is one session per week. With the virtual training, persons are trained both as participant in the program and also as a leader. And there is the teaching practice also. So we do have plan to train more leaders, but we will be going about doing it differently and also with the help of POW. Because as a master trainer, I need another master trainer to do the training. And although right now I'm the only one on the Ministry of Health, but there are other regional trainers that have worked with that we can offer the program. So you can imagine it's it's not at a cost to participants, but it will be, usually we get support from PAO, so it's at a cost to PAO, whether it is face-to-face, where the other master trainer has to come in on island, or whether we do it virtually. But persons who are interested in being leaders, you can contact me. You can contact Dr. Louisi at the ministry. And when we do have that program, we're offering the program for leaders, you will be contacted. But I do encourage persons, if you're interested in being a leader, it's very important if you get the opportunity to participate in the program as a participant, so you get a better idea what is the program all about, and then you can decide if you really want to be a leader for this program, facilitating this program. I hope I've answered your question. Someone said that the program, well, as a participant, the program is open to anyone living with a chronic condition. The program is also open to caregivers of that person, their family member. You can register at your nearest wellness center. You can also call Bureau of Health at the ministry, and you can register, inform your nurse or any other healthcare worker at the wellness center that you're interested. Once any community or wellness center has the number of participants that I mentioned, that we can come in and offer the program. So if you want a virtual program, it's 8 to 12 persons. If we're going to do it face-to-face, then it is 12 to 16. So once we have this number of persons, we come into the community and we offer the. Yes, the presentation can be shared, not a problem. Yes, the program is open to everyone. It's open to nurses, doctors, anyone who wants to participate in the program, it is open. However, the program is really a pair-led program. They encourage that at least one of the leaders should be somebody living with a chronic condition, but it's not a must, because I'm a nurse. At that time, I had no chronic condition from 2015, and I was a leader, a master trainer in the program. But professionals can participate in the program and be leaders in the program also. Once you are willing to devote the time and implement the program as it should, you are welcome to participate in the program. I must mention also that I'm aware that the program was being offered by the St. Lucia Lupus and Arthritis Association at some point, even before the minutes had the program. So it's a well implemented program. Yes, I'm here, Doc. Once the program is implemented widely and persons do come out and participate, the program can have a great effect beyond your imagination. Because even with the small groups or the small numbers we did prior, you can actually see the changes within the 6 weeks period, how persons are transformed with the program. So once we can get to mobilize persons, we can get persons to come together and participate in the program, it can have a great effect. It can reduce our prevalence, it can improve our management, it can even people's social lives, you know, how they deal with conflict, how they look at life, the psychological impact, how they approach challenges in life. This program is very detailed. And what we've, as a leader and master trainer, what I've experienced during the program, a lot of emotions come out. Persons get to talk about things that they would not normally talk. They express themselves. So one of our ground rules in the program is that it is confidential. Within that space, whatever that's discussed, we keep it confidential, because maybe depending on the topic that's been discussed, people really express themselves and you know, let people know what they've going through or how they've dealt with different issues in the past and so on. So this program can have very positive impact on our population. So I encourage persons who are now on you know, to encourage persons to participate. When you meet with the patients, you meet with their family members, groups that you belong to, church, social groups, and so on. Inform persons about the program, encourage them to participate. If you belong to a group, you can invite me. I can get the other leaders to come in and to offer and facilitate that program for your group, or you know, within your community, whatever setting that you're part of. One of the things that we were working towards is to actually carry out a research on the program. At the time, the Ministry of Health had a monitoring and evaluation officer, but that person since left the position. A lot of work actually the proposal is available. So that's one of the areas one of the things we're looking to do is to actually research the impact of the program. We've implemented the program at Bodley Correctional Facility, which is like a control setting. And we encourage our participants to continue monitoring. And like I said, it's not a one-time program. If someone has done the program before and they feel they need to do it over, they're welcome to participate. So although the program is for a 6 weeks period, normally we don't tell the participants that, but participants well, they are issued a certificate of participation after the program. So all persons who attend at least 4 sessions or more are issued certificate of participation at the end of the program. Because the way the program is designed, a lot of the skills are repetitive. So 4 sessions, you should give enough exposure and practice to a participant to gain mastery and competence in the skills that are taught in the program. And also for persons who are interested in becoming leaders, it's very important to that you can speak the Creole, because there are things that you really need to break down to participants' level so that they can understand what it is that is expected and understand what's being taught in the program. Well, it depends on the community you're in, you know. So persons who are more comfortable with the Creole, you may need to translate some of the things and break it down using the Creole language. You,
Not a problem. My pleasure, actually. The chronic disease, sorry, the capacity building project for the prevention and control of metabolic chronic diseases. This project arose from an agreement between the St. Lucian government with the Ministry of Health and the Taiwanese government, Taiwan ICDF, to undertake the project because of some of the results of studies that had been done with the STEP survey and the behavioral risk survey that had been done. And so those studies had revealed that we had a significant number of our population that was obese. I'm talking about 65 to 70%. And the percentage of patients that were finding out that they were diabetic and hypertensive family members. And so just give me 1 second. Sorry about that. And so the project intends on having 15 healthcare providers, doctors, nurses, nutritionists, and the CDSMP leaders to be trained in Taiwan to return and train the other team members for us to improve our health screening capacity and our counseling capacity, because we would like for us to see not only better control hypertensive diabetes and patients with kidney disease, but less patients having the complications of high blood pressure and diabetes, ending up with chronic kidney disease. And we would also like to know what our at-risk population is. When we know what the at-risk population is, then we can better change lifestyles to reduce the incidence of high blood pressure and diabetes. And we can start having a different conversation as to preventing or delaying the onset of the chronic diseases that we're trying to liberate ourselves from. So I was very happy to find out from Dr. Dodd that this annual event will be happening, the Liberation and Emancipation, Freedom from Chronic Diseases, because it works out very well with what the Ministry of Health is now undertaking through the capacity building project. And there are a few other initiatives, if you would permit me, that I would mention, like knowing your numbers, which I knew about when I was preparing my presentation for the medical nutrition therapy, which is why I had mentioned we need to ensure that our patients know your numbers. Also, we have the St. Lucia Moves initiative, which is a local branch of something that is actually international. And so there is Caribbean Moves, we have St. Lucia Moves, there is Grenada Shifts, there's Jamaica Moves, and the ministry has been tasked to be responsible to ensure that we have workplaces and schools and faith-based organizations and NGOs like SLHDA, ensuring that there is a workplace wellness program, that we encourage physical activity, that we highlight the benefits of physical activity and how you can actually involve physical activity in your daily life by having every 30 minutes or every hour you do 2 to 3 minutes of walking or stretches. So the ministry has been working on many different initiatives, all of them which tie together. And so you find the same people working on the different initiatives, but although they all have different names, the goal is the same. The goal is to ensure that we have a more physically active society. We have a society that eats healthier. We have a society that's more aware of their chronic condition, if there's one, aware of their vitals, aware of the importance of their annual screening and annual checks, aware of the importance of their dental hygiene. So it is an educational drive, basically, and to pull in all of the key stakeholders, because it cannot be the Ministry of Health on its own. The stakeholders would pull their weight, as I would say, in terms of getting all of society involved. And so the capacity building project is working with the ministry to ensure that those goals are achieved. Any questions? Okay. There is no one correct answer to that, because what pertains to you and your busy lifestyle does not pertain to me and my busy lifestyle. But there are some foundational rules that would apply. Basic lifestyle change is key. We need to understand that the multidisciplinary approach and patient-centered care is essential. We need, as healthcare providers who are patients ourselves, we need to ensure that we spread the word, we educate our population that lifestyle has a much more important role than they may realize. What I usually explain to my patients is your healthcare and your achieving healthcare goals is like riding a horse. Your horse has 4 legs. In that, you have one leg, which would be your lifestyle. Your other leg would be your diet and exercise. I give a whole leg to water for hydration and kidney health and all of that stuff. The last leg is made up of your healthcare team, your healthcare providers. So you have your dentist, your nutritionist, your mental health nurse, your pharmacist. You have all of those, plus the medication on one leg. If you cut off one leg, you will limp, you will hop as a horse. You may not be able to gallop and go far. But if you cut off the 3 legs, you cut off lifestyle, you cut off water consumption, you cut off stress management, you cut off those things, you cannot get anywhere. So we need to understand as individuals, stress management. We need to understand socializing. We need to understand our sleep habits. We need to understand that those things that are heavily dependent on us, these things play an essential role in how well we do as individuals with our chronic conditions, and so how well we do as a society and a country. And then comes the role of our policymakers to highlight and emphasize the importance of lifestyle changes and being aware of the need for somebody to be able to be well, even with their illness. I hope I answered your question. Okay.
Yeah. Good evening, Dr. Daw. Let me say that this is a most welcome activity, but I think it is important for this not to be just a one-off thing. And speaking from my location in Beaufort, I think it would be a good thing to have this sort of thing repeated more than once. It is something that has to be ongoing. And I don't know if you can get a commitment from the ministry to further assist us in getting this important message across to the whole of St. Lucia, particularly the southern heart of the country.
Well, I would like to thank the association for having me as a presenter this evening. I just want to encourage you, Dr. Daw, the president, and the association in revamping the community groups because it is very important. If we have functioning community groups as we did in the past, that we can work through them, especially when it comes to education and even creating an increased awareness of chronic conditions and how persons can prevent, early screening and management. So I'm looking forward to see the groups being revamped and being as active as they used to as part of the association. Thank you.
check, 1, 2. Mic check. Testing for sound. Mic check. Welcome to Breaking Barriers, the Emancipation Gala, 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 Gala. These are we won't hear. That's right. Thank you very much. Good evening, Dr. Doe.
Good evening, Mr. Justin. Sant Justin.
That is it, yes.
Please help me out there.
Very hard. You're very hard, sir.
I will do my best. So thanks for having me. Well, I am the host, as you said.
That's right. So you take the mic.
Thanks for having me. So, yes. He's almost taller than me. Right. So tonight, welcome everyone. Welcome one. Welcome all. Our theme: breaking barriers. We are here at the Green Acres Cabana, live filming this virtual first annual event, Emancipation Gala for the St. Lucia Diabetes and Hypertension Association. We thank you so much for joining us. We thank you so much for making this happen. All right. Without you, it would not be possible. All right. And this gala started off as a need to stand out. The association, the board met, and we said, we really need to find a way to make ourselves more visible. We need the St. Lucian public to understand that we are here for you, we are here with you. And what better way than to come out boldly and have a flagship annual event? Now, like everything else, money talks, right? Yes. So, of course, yes. So, of course, it is also a fundraising event. What does that mean for fundraising? Yeah, so we have to get the checkbooks ready.
That's right. That's right.
Check the balance on the accounts. Get the cards ready. Yeah. Right, because we have quite a few things lined up for us, right? Yes. We have a. What is it we have again?
Right. So to talk a little, let me introduce the upcoming silent auction. We have a few giveaways to do later, but unfortunately, fortunately, only persons on the Zoom can participate, and you participate by sending in your bid. Put it in the comments. We'll go in there a little later. Private message to the president of the SLDHA, who is standing right next to me. That's Dr. Doe.
Yes.
Right. So just to let you know what we have auctioning a little later. We have a dinner pass.
Oh, nice. Dinner pass. Yes. A lovely dinner pass at one of our lovely resorts, the Cocoa Palm Resort. Yes.
Actually,
we also have another one at the Sandals House here.
Well, I believe Cocoa Palm has given us the brunch. So yeah. So there's a brunch pass and the dinner pass. So
So can I win both? If it's a bid. So if I bid for both, I can do brunch at one resort and dinner at another. Isn't that awesome?
I'll have to check the rule book to see if you can bid. But yes, you can bid on both dinner pass.
Don't mind the big belly, but I could do some brunch and dinner. Thanks.
A good thing is you had pointed out and not me. Apart from the dinner pass and the brunch pass, we have a bathroom chair. What exactly is a bathroom chair?
Oh, our friends at Peter and Company Distributors gave us this lovely device. So, if we haven't noticed, our population is aging. It means medicine, technology is putting us in a position where we can live longer. As a result, those joints will start to hurt. Some of us it starts early. Yes, those joints are starting to hurt, and you might just need some help to even take a shower. So there's this lovely chair that you could sit on in the shower and take care of that important part of your day. All right.
Do you need to have joint pains to use that shower though?
Well, I'd hope that we want to stay clean. So, yeah,
Asking for myself, by the way.
yeah, you don't need to have joint pains, but it was designed for that. I will not even read into what it is you're thinking.
What I was actually thinking was anyway. We also have 2 cell phones to give away.
Yes, yes. Our sponsors again, we could not do it without you. So everyone out there look forward to getting lots of giveaways and taking part in this auction. So there is a cell phone provided by the Cell and one provided by Digicel. No, the Cell has the tablet.
There's a tablet and a cell phone.
Tablets, cell phone, and another cell phone.
Ooh, nice. One from Flo or just?
Yes, one from Flow and one from Digicel. Imagine that.
So we don't discriminate.
Yes, we don't discriminate at all.
Right.
Just like diabetes and hypertension does not discriminate against who they affect, we do not discriminate against who we're going to help tonight.
Dr. Doe is quick on his feet. I see what you did there. That's beautiful. That's so, Dr. Doe, we just want to do a quick recap of what happened, what took place a little earlier via Zoom. And if you were logged on via the television or Facebook, GVD or NTN, you would have heard some speaking in a conference format. So what it was a scientific conference. So before we talk about the details of what happened, let's talk about what a scientific conference is.
Right. So the Diabetes and Hypertension Association in St. Lucia thinks that it's necessary we move in the direction of evidence-based in everything we do. So the idea is we would want to have this annual conference where our solution researchers come and showcase what they've done, what they've developed, what they've understood in our environment. So for example, 2015, WHO PAHO put out this statistic that we have a prevalence rate, that means we have in our population a little over 27% living with hypertension. And the diabetic range or study shows that it's just a little over 14%. Would you actually believe that that was the case? Based on the hype out there, based on what it is we're saying, you know, what it is we hear so much. We hear so much more about diabetes, right?
Yeah, we like bread and other things, you know. It's not surprising.
Yeah, we hear so much more about diabetes as compared to hypertension, but yet hypertension is more prevalent in our society than diabetes. Why is that? Honestly, why is that? I believe that it is because hypertension is a silent killer. What does that mean? Your blood pressure should not be higher than 139/89 at any given point. Well, unless if you're doing something exciting, but that should be very briefly, and it should come back down nicely, right? Yeah, you went off there on that something exciting, didn't you? Anyway, yeah, so anyone with the blood pressure higher than that continuously or persistently is living with hypertension. But the beauty is I can be walking around with a pressure of like 250 over 130 and feel absolutely fine. We have seen it so much in our health centers, in our hospitals. These persons will likely present for, I have pain in my foot, I have pain in my hand. And then we check their blood pressure, we notice, my goodness, that is sky high. It's a stroke. There you go. That's a heart attack. That's kidney failure and dialysis waiting to happen. All right. But we have no symptoms until something like that actually happens. I believe that's the reason. Is that true? Do you know? I don't. Okay. And hence the idea of the scientific conference. Let us do more studies. Let's do more surveys. Let us try to understand our population better. What is driving our NCD burden today? All right. What is driving the problems that we have? What is driving all of this and slavery, you know? I mean, I want to be able to walk around free. So with a scientific conference in St. Lucia, we will be able to answer a lot of those questions. Moving forward, we also would like to give our St. Lucian researchers a stage on the international scene. We're a partner, we're a member of the International Diabetes Federation. So we would like to also take one or two of those abstracts or researches and take it to our annual IDF conference where they could represent St. Lucia and showcase what it is we've done. Because very often we say, what's happening in the first world, or Koikadi, Lamaweka, Estene, you'll get the call, yeah? We. So is that really true? We want to know what's happening for our people, what is really going on here. Let's use the information and let's use ours and see which one really sticks.
But Doc, you're saying you want Little Helen to do scientific research and go to big America and present statistics. I mean, you're talking about Little Helen. Little Helen.
Forgive him, my viewers. It's like he didn't just hear about Julian Alfred, right? He doesn't know about our long-standing, so high jump her name again? Laverne Spencer, yes? All right. So how could you stand here and tell me Little Helen?
I mean,
We're not Little Helen.
Little Helen.
We're Helen.
Right.
All right,
So you
we're
think
Helen.
we can make a mark on the world with our statistics?
Like he did not hear about Sir Arthur Lewis, Derek Walcott. Like, come on, man. Really? Let's move on. Let's move on. Because I think one of the viewers might come here down to Piero and want to tap you on it.
No, we were fine until you said Piero. They didn't know where we were.
Oh, wow. Yeah, we're in Piero. Green Acres Cabana. You can come find him. Before what he's saying, he's underestimating Little Helen of the West Indies. Not Little Helen of the West Indies.
Doc, before we move on, I'm a young man. Okay.
I hope so.
In my early 20s. You know? Why are you laughing like I'm not looking 20? Don't answer that. Why would I worry about diabetes and hypertension? I mean, 20 years old, I can eat what I want.
Well, that is true. At our mini symposium earlier, Dr. Jenny Isaac Lucy did highlight that we can eat everything. However, it is important, the portion sizes is important, how it's prepared. It's important that you eat it in context. All right? So why would you worry about it? Because guess what? Back in the day, our parents and so on, they used to eat a lot of what they wanted, like you're saying, but they were also a lot more active. Technology has brought us to this place where our water is right. In fact, I can put a tap right there. You know, I can put an AC unit right here. I don't have to go by the river.
You don't remember the days when you used to carry the buckets,
Yeah, those
by
days,
the river and wash.
those days are
on the
gone.
rock, yeah.
Those days are gone. All right. Right now we have it easier. All right. Now that we have it easier, it means we will not be as active. So you as a young man need to keep that in mind. Although the image here clearly says this young man is doing better than me, but that is life. You know, that's life.
Doc, if it's one thing we learn is looks are deceiving.
Oh, yes, all the time. You know, we have a lot of our, well, not, let me not say a lot, but we have some of our bodybuilders who do get heart attacks and do get kidney failure because they might be doing it the wrong way. They don't understand that healthy means physical activity and the right diet in a good balance to maintain a lovely cardiovascular flow. That's the big word. plumbing system, the water needs to run. All right. The heart is the pump. The blood, it needs to run through the whole body for it to do everything with vitality. Yeah.
So we're doing what's necessary to ensure our heart working properly and the blood is flowing properly.
Indeed. So as a young man, it is important for you to keep that in mind because we're diagnosing quite a few persons. I'll calm down on the joke now because this is a serious thing. We're diagnosing a lot more persons at a younger age with diabetes, with hypertension. It starts with the lifestyle. All right. I mean, Ms. Arsenault mentioned it in her presentation, the chronic disease self-management program, which speaks to the psychological aspect of it. You know, even myself, I need to understand that you need to take some time to take care of yourself. You know, we all need to make sure that we look at health as not just the absence of disease, but a state of complete social, physical, and mental well-being. So it does include me making sure that the wife doesn't nag me at night. You know, you got to take care of the wife, make sure she understands that, you know, nagging will stress me out and I might not sleep well at night and my pressure will go up.
That's not a real example, right? That's just for show, for TV, right? It's for TV. It's for TV. It's for TV. Yes, sir. I mean, I'm not trouble.
You're not in trouble? Well, thank God you don't know my wife. So that's good. So, wait, no, we're on TV. Oops. Honey, I'm sorry. I'm just kidding.
He's sorry.
So, right. As a young man, it's important. You need to keep that in mind that it can hit you early. It has been hitting us early, and you need to take a step today. Why am I sweating so much, Chin?
I'm cool. That's why. So basically, what he's saying, catch me on VG Beach, running up and down on the sand. I mean, in my current situation, I can only do one trip, but it's better than nothing, right?
I can do 3. Yeah, I can do 3. VG, up, down, up again. Yeah.
Challenge accepted.
VG, yeah.
Challenge accepted.
20th
of September. Challenge accepted.
20th of September. Yes. Look out for it.
I'll do flyer.
And I'll finish beforehand.
St. Lucia moves. Let's go. So, Doc, just to talk about the rest of the programming tonight, it's not just about the two of us standing here talking.
I'm having quite a bit of fun talking to you and breaking barriers. So for the rest of the night, let's understand that there are barriers in so many different ways. And I would like to kill the first barrier here. Please don't refer to me as Dr. Daw. All right? Yeah, you can call me Daw, Kedma, you know. Yeah, let's make it informal, let's make it easy going. And this is important, you know, because our patients sometimes they have this block. I would speak to them, they say, "We doc, yes doc, I understand." By the time they walk out, they don't say, "No,
Shall we get down?
Yes. We need to really break some of those barriers. So tonight, let's start with breaking the barrier.
Right.
We're the hosts.
Okay.
All right. We're brothers. All right, in here in St. Lucia. I'm the more handsome brother. Yeah. Okay. So that's okay.
Yeah. No comment. So Ket.
Yes.
Just to talk about what's coming up a little later this evening. It's not just us here speaking, shooting the breeze. What else do we have? I see some guys setting up in the back. They look like folk singers. What else do we have on the program for this evening?
We have the auction. Did we even finish talking about the auction? You see, you like to talk so much. Yeah. So we have the auction. We have some giveaways, and sadly, those who did not register with us on Zoom cannot take part in our giveaways. All right, those listening to us live on NTN and GVD, we're happy to have you, but sadly you won't be able to get any of those prizes.
Dinner,
and
brunch,
tablet, cell phones. Oh my gosh, there's so many other giveaways.
I feel it for you.
Yeah, man. So other than that, my favorite part.
Talk to me.
Tonight, we're gonna have a unique culinary experience.
You said culinary. Got me at culinary.
Yes.
Yeah.
We're talking food.
Food. Yeah. We don't have to go any further.
Yes.
Should we mention who's? Okay, sorry. Go ahead. Excited, no? One, you two. Sorry, go ahead.
All right, so let's get back that announcer voice.
Yeah.
A unique culinary experience here at the Green Acres Cabana with the one and only Chef Orlando. So tonight, yes, he did, and he took it a step further. Mamai Lakai, you will be enjoying. What's about it? All right.